and then fasting. But first, let's talk about depression. What is depression? Depression is a disorder that affects the emotions or affect. And in general, you can say it is a slowing down of motor activity, of speech, of thinking, and a depression of mood, or sadness, or grief. It is associated with some other symptoms, which I'll talk to you about later, after we review what characterizes this depression. First of all, there are different types of depression. There are severe depressions, there are moderate depressions, there are mild depressions, and then there is what you call the bipolar affective disorder, or what we used to call manic depressive illness. And this consists of periods of depression alternating with periods of elation or overactivity, good mood, or excessive emotional positive mood, ecstasy and the like, and over talking and overspending and other symptoms. Then we have the depression that comes from within, or what we call endogenous depression, as opposed to the reactive depression, that is depression that is a reaction to outside circumstances. In this latter, we have psychosocial stresses which lead to a feeling of depression, stresses like loss of a loved person. And in normal people, this loss is associated with grief, which is really a form of normal depression. That is, we don't treat grief as an illness, and we don't give medication or psychotherapy, but we do give support and encouragement, and we try to share with the person who's grieving his feelings. But grief is, as I said, a normal reaction. Sadness is a normal state of feeling, as opposed to depression. Sadness means feeling bad about losing something or failing in something, and it is understandable. You can relate the feeling of sadness to the situation, and you can understand why the person feels sad. It's very much like depression, except that it is understandable, it is rational. Again, we don't treat sadness as an illness. As a matter of fact, we try to turn depression into sadness as a form of treatment of depression, because sadness is a healthy state of mind, but depression is not. Depression is an illness. It is an illness because there is no direct relationship between the mood and the circumstances that lead to it. And in all probability, we have predisposing or constitutional or genetic factors which lead to this state of depression. And a loss of a very minor object of love can lead to a severe state of depression. Say a loss of a pet, a cat or a dog or something, can lead to a severe state of depression in somebody who is predisposed and ready to have this depression. In a normal person, it will lead to a temporary state of grief or sadness, but in an ill person, it will lead to a state of depression. That is, the feeling of sadness is exaggerated, it is prolonged, and it is associated with different symptoms. You can say that this forms the etiology of depression: genetic, constitutional, early environmental factors like early loss of a love object which leaves its imprint on the individual, and current precipitating factors like loss of a love object or failure to attain a goal or similar frustration. Now, coming to the clinical picture, I already mentioned some of the major characteristics of depression. You can say it is a general slowing of thought, slowing of action, what we call psychomotor retardation, a lowering of mood. It is often associated with guilt feelings. That is, the person blames himself for things which any other person would normally forget or forgive himself for having done. And this becomes so excessive that it is a preoccupation for the patient and prevents him from concentrating on his everyday activities. That's why many depressed people complain that they have lost their memory. It's not that they have lost their memory, it's they are not concentrating enough on their current, everyday, here and now activities, and because they are not concentrating, they do not remember. It's not that their memory centers are affected. In addition, we have this guilt and self-blame, a recollection of past events. You find the depressed person does not remember recent events very well, but remembers past events, and as I said, he looks at it from dark glasses and remembers the mistakes and repents and feels guilty, blames himself all the time. This is often also associated with somatic symptoms, and sometimes you have depressions coming only with somatic symptoms. As a matter of fact, many depressions are not diagnosed by the general practitioner because they come only with somatic symptoms and do not complain of the depressed mood. They come with loss of appetite, stomach aches, colics, headaches, and similar pains, fatigue, bodily fatigue, loss of energy, and various other somatic manifestations. And general practitioners tend to treat these conditions with vitamins and tonics, and they misdiagnose the depression. Sometimes it is only one somatic symptom we call monosymptomatic depression. And again, they are given analgesics or tonics or vitamins, and the real diagnosis is missed. Coming to treatment, we find that there are modern antidepressant drugs, and especially the so-called specific serotonin reuptake inhibitors, which have very few, if any, side effects as compared to the old tricyclics, which are just as effective, mind you, but they have side effects. Coming to the question of fasting, would I ask the depressed patient, or would I permit him to fast? I think yes, because the depressed patient already feels guilty, and if he doesn't fast, he will even feel more guilty, and this will complicate his illness. If he fasts, this fits in with his tendency to punish himself. But instead of looking at fasting as a punishment of self, it becomes a positive action, that is, purification of self. Anyway, the depressed patient has a loss of appetite, and if he fasts, it is really no different for him. And most of the medicines are sufficient to be taken once or at most twice a day, so we don't need to break the fast in order to take medicines. Another effective treatment for depression is electrical treatment, or what we now call brain synchronizing therapy, as opposed to the old name electroshock or electroconvulsive therapy. And again, if the patient is taking this electroshock, then he should not fast, because it involves taking intravenous injections every other day. Thank you very much.